everybody. Welcome back to Psychedelics Today with your host, Kyle Buller. In this episode, I get to chat with Veronika Gold from the Polaris Insight Center, which is a Ketamine Assisted Psychotherapy center. Veronika has a master's in counseling psychology with a concentration in integral counseling from the California Institute of Integral Studies, CIIS, and also a master's in psychology with a concentration in clinical psychology from Charles University in Prague in the Czech Republic. Veronika also specializes in EMDR and somatic experiencing, and also has a lot of experience with holotropic breathwork, which is really cool. So in this episode, we get to chat about part of the difference of a ketamine clinic where they use the IV model without therapy versus what her and her partners over at in Polaris Insight Center, they use the Ketamine Assisted Psychotherapy. So we talk a little bit about the difference there and why maybe somebody would pick an IV clinic versus choosing a service of Ketamine Assisted Psychotherapy. So we go all over the board with ketamine and what's going on in the ketamine world a little bit towards the end about S-ketamine and the future of Ketamine Assisted Psychotherapy. We also chat a little bit about holotropic breathwork and the Groff model and how they operate over at Polaris. And we also chat a little bit about somatic work, so somatic therapy, and why it is important to incorporate the body into trauma work and also when working with psychedelics and other non-ordinary states. So I hope you enjoy this episode. I had fun chatting with Veronika. Been meaning to get her on the show for a bit, and finally it worked out. So really grateful that happened today. Some quick business. If you would like to support the show, you can leave us a review on iTunes or our Facebook page. Reviews go a long way and help us out. We also have 2 books, the Navigating Psychedelics Integration Workbook and then the Trip Journal. Those are available on our shop at psychedelicstodayshop.com. That's for the PDF version. If you want a physical version of the book, you can go over to Amazon. Just type in Psychedelics Today in the search, and I'm sure it will pop up there. Really great books. The first one is like a trip report book, so you get to write your experience down, some journal prompts, kind of prepping you for it, and little sections on harm reduction. And then the integration workbook is just a collection of different activities to help you integrate your psychedelic experience. And you could probably also use that for any other non-ordinary state of consciousness, such as like working with breath work or whatnot. So there's some dream work activities in there, goal planning, and other journal prompts to kind of get you thinking about what integration means and how to move these experiences forward. What else is going on? So Joe and I have a workshop coming up in Breckenridge, Colorado. I'm not too sure when this episode will be released, but if you miss it, hey, we'll be probably be doing some more workshops in the future. So excited about that. It's doing a transpersonal breathwork workshop and also offering Navigating Psychedelics live in person. So we're thrilled about that. We also have a few seats left for our Navigating Psychedelics course, our live supported course. Again, when this airs, not too sure, but the classes start mid-May. We have a track for the general public. We have a therapist track, and then also a track for physicians, which will be taught by Dr. Matt Brown, who we've had on the show. If you want to go learn a little bit about Matt, you could just go into our podcast archive and just search for his name and learn a little bit more about his work. So we're excited to be offering those. If you missed the boat, if you're listening, well into the future and it's already passed, stay updated, because I think we'll be running these courses throughout the next year or so, different cohorts, different times. So if you missed it, well, just go over to Psychedelics Today and get updated over there. So I think that's about it. I hope you enjoy this episode, Veronika, and let us know if you have any questions or comments. Send us an email, psychedelicstodayemail@gmail.com. Enjoy. All right, welcome back to Psychedelics Today, everybody. Here's your host, Kyle Buller. Today we're joined with Veronika Gold from the Polaris Insight Center. They offer some ketamine assisted psychotherapy, and I'm guessing regular psychotherapy as well. Yeah, do you want to give us a little intro about who you are and a little bit about your background?
Sure. Hi. Thanks for having me. So, my name is Veronika Gold, and I am a psychotherapist. I specialize in the treatment of trauma. And I'm one of the co-founders of Polaris Insight Center, where we provide ketamine assisted psychotherapy. I am as well a sub-investigator and co-therapist on the MDMA clinical trials for the treatment of PTSD, sponsored by MAPS in a site in San Francisco. And I, originally come from the Czech Republic. I was a psychologist there, and then moved here in 2003. Studied at CIS and kind of continued my pursuing of treatment of trauma in all different ways.
Awesome. How did you get involved in wanting to be a counselor, a therapist, and even involved in like the realm of psychedelic medicine?
As I grew up in Czech Republic in a communist time, and so there was a lot of just trauma growing up in that system. And when I was 15, the revolution happened, and a lot of people who lived in the time outside of the Czech Republic were coming back. And so one of them who started to visit was Stan Grof. And so I met him when I was 16. I went to the transpersonal conference and was just fascinated by the work he has been doing and his study of non-ordinary states of consciousness. And holotropic breathwork became a big part of my personal healing and kind of exploration. And that led me to study psychology and become a psychotherapist. And so since then, I've had those kind of two interests of psychotherapy and work with non-ordinary states, and kind of finding a way how to combine the two. But it really wasn't until a few years ago when I was invited by MAPS to be one of the therapists when I was able to start, working with psychedelics.
That's awesome. So you got involved pretty young. Like what kind of going to a transpersonal conference when you're 16? How did you get involved in that?
I know, Kyle. I don't know. Like sometimes when I remember it, I was like, wow, that was like really young. But I think it was just when the revolution happens. It happened in 1989. I was in school and just, everyone was, in the streets and, kind of something what nobody ever believed could happen, that the communism would end, that there would be freedom. And so there was just so much opportunities. And so we were just hungry to learn as much as we could. And, I think one of my friends somehow met one of Stan's students and talked about it. And so we went and, got inspired and went on that path.
That's amazing. Even just to get started so young in this, like just having an interest in transpersonal psychology, I think that's pretty cool. Were you able to make it to the transpersonal conference back in Prague? What was that, a year ago, 2 years ago?
Yeah, I went. It was it was great. It was in October, a couple of years ago, and it was kind of coming back. It was very interesting for me because I've been outside of the Czech Republic for 20 years and kind of seeing all the people I started this journey with, and a lot of therapists I respect, and then people from the US. So it was a great event.
Yeah.
Did you go?
I did not. I really wanted to. Just wasn't in the books for me. I've been really wanting to make it over to Czechoslovakia, or what is it, Czech Republic now?
Yeah, Czech Republic, Czechia now they call it.
My grandma is originally from Czechoslovakia, and so she came over when she was, I think, 12 or 13. So we always wanted to kind of go over there and explore some of those roots.
Oh, awesome. Yeah, I hope you can go.
Yeah, one day. Cool. So let's I guess dive in and talk a little bit about ketamine assisted psychotherapy. So we were chatting a little bit before we started recording that there's these different models, and this might be an interesting avenue to explore. And Joe and I kind of touched on it briefly in our episode about ketamine and esketamine. So Yeah, what are the models available right now for ketamine therapy?
Great. So ketamine, has been used in medicine since the 60s, but it was mostly used for anesthesia. And because of the psychedelic property of ketamine in higher doses, people, when they were coming out of the anesthesia, would have, these psychedelic experiences or transpersonal experience that they would be, sharing with the staff. And sometimes they were positive and sometimes they were really distressing. And so in the Western medicine for anesthesia, they started to use ketamine together with other medicines like Versed that creates amnesia of what happened. But that became interest for psychotherapists and psychiatrists to study this property of ketamine. And so ketamine therapy has been studied since the late 60s until now. And so the different ways of working with it have been developed. The most studied way of working with ketamine now is the ketamine infusions, which I would not call psychotherapy or therapy at all. It is a medical intervention where it's taking the benefit of the ketamine and its effect on the body, and has been researched mostly with depression, treatment-resistant depression, and some other mental health challenges like PTSD, anxiety, obsessive compulsive disorder. And there is a lot of data from this research that the medicine is effective in lifting the symptoms of depression. It's not a cure, it's like a symptom relief, but as well it has less side effects that a lot of other traditional antidepressants, and as well has lower side effects. But so that is one model that became popular over the last few years. Mm-hmm. Then now kind of what you talked about in your episode about esketamine, which has just been approved for treatment of depression. That's going to be, it just started to be used in office treatment. So that is, the second use. And the ketamine assisted psychotherapy is completely, or not completely, but the belief is that we, are taking the benefit of the medicine, but the therapy is as important as the medicine, and what comes up in the sessions. And the non-ordinary state of consciousness is part of the healing. So what is in all these other models considered as unwanted side effect is the principal effect of the way how we are working.
Right. And I guess I'm wondering, like, what's your take on it? I'm guessing, it's a complex thing, right? The biochemistry of it, how it's affecting the brain, that's obviously causing some sort of effect. But are you kind of in that realm where some of these transpersonal states is part of the healing, or more on like the biochemistry side of things where it's like, it's affecting this receptor site and that's what's causing the change?
Yeah. Uh-huh. So I think the way we work, that both is true. Mm-hmm. And that, the first models I talked about is not, how I work. And so all the work we are doing is in the ketamine assisted psychotherapy, working with lozenges and intramuscular sessions. And there is definitely the biochemical effect of ketamine. There is that lift of the depressive symptoms that can happen. There is increased neuroplasticity. So what people do in therapy and some changes they make can be kind of easier sustained during the treatment. But then the power of the non-ordinary state is really a huge part of what facilitates the change. And we believe that working with that non-ordinary state and therapy, that actually healing can occur. That it's not just a treatment that kind of helps with the symptoms and that people feel better, but actually that they eventually don't have to continue the treatment, and that there was a transformation and healing that happened.
Right. Do you think that like some of the ketamine IV infusion centers, like, do you think some patients like miss out that component? Like it's a really big component of the healing process? Or do you think like in the IV clinics, like, obviously they're getting benefit. Otherwise people probably wouldn't be spending the money on it and doing it. But do you think it would be like, I don't know, to add therapy to that really maximize the benefit there.
Absolutely. And I think that every client or patient has to be, assessed. What is the best way of working for them? And there are patients who greatly benefit from the ketamine infusions as well, that has been used for treatment of chronic pain. So that is something what we cannot treat in the way with lozenges and intramuscular sessions. So if somebody needs ketamine treatment for chronic pain, I would refer them to ketamine clinic. But in general, I think that people don't get the maximum benefit they can if they're willing to look at their things and work on the underlying issues. And, for some people, it can be even damaging because they go to a non-ordinary state without support of a person who is trained in working with non-ordinary states of consciousness. And they can have, really scary or uncomfortable experiences. Mm-hmm. As well, the ketamine works that it can really shift the state rapidly. So the person kind of has the lift of the depression. And for many people, healing from depression looks like that. First, there is more anxiety or more kind of activation in their system. And we see that a lot of people need psychotherapy support to get through that state before they kind of feel more in the normal state of being. And, that is not always available for at the infusion clinics.
Right.
So I see that can be, challenging.
Mm-hmm. And I think like that aspect about pain, I remember talking to Kevin from Ketamine Wellness, and I also have a friend that went through some of the infusions for physical pain, but that was one thing they brought up that they really do well treating is like chronic pain with the longer infusion sessions. So that's interesting. It seems like that's like a beneficial model if you're looking for something like pain relief.
Yeah, absolutely. And I worked for a year in an infusion clinic, and there were some patients who were not interested in psychotherapy, and they're like, I want to relieve these symptoms, and I'm fine for coming for booster sessions, and that worked for them. So that even though I believe that psychotherapy is helpful and that resolving underlying issues is the more helpful way, I as well have to recognize that that's not the way for everybody, and that's not what everyone wants to do.
Right. Working in both of those clinics, right? So the psychotherapy model, and then you have experience in the IV clinic. What do you think the pros and cons to, like, if somebody was seeking treatment, like what are the pros and cons to each way that operates?
So I look at the infusion clinics as a medical model that's really using the biochemistry of the ketamine. And I would recommend for most people who are seeking healing to do ketamine assisted psychotherapy rather than infusion. There are times when the infusions are more appropriate. But the way, what I value about the work in the ketamine assisted psychotherapy is really the set and setting of the work, that people come and, it doesn't feel like a medical procedure, even though there is a medical doctor and there is, medicine involved, but people, we focus on creating safe environment, that our rooms are, like kind of home-like environment. People, lie down in a bed. We use eye shades, which, they use at some of the IV clinics as well. And then we have music that's specially curated for the ketamine treatment. So that, accompanies the treatment. We, work with the person to get to know them, to understand their history, what changes they want in their life, collaborate with their therapist. We as well ask everyone who comes to treatment with us to have an outside therapist, to have ongoing support around things that come up, because we see that so many things can come up from the session that to get the most benefit is for people to be able to continue the integration with their therapist. And then, we really hold the sessions as a ceremony. So we have 3-hour long sessions. They're 2 to 3 hours. Sometimes they can be 4. but in, average it's about 3 hours where, we work with kind of connecting with oneself and kind of creating a sacred space and really allowing for unfolding of the experience, and then starting the integration process at the end of the session. So it's and we use the non-ordinary state of consciousness as a part of the transformation. So it is, what I believe and how I like to work. So I'm biased for this approach, but
yeah, I think I'm in the same camp right there with you. And so you use both lozenges and IM. I hear, like, I remember talking to Dr. Scott Shannon, he said he was really into IM just because, like, the effects of it and whatnot. What's the difference, or what have you noticed? What do you like to work with?
Yeah, so they're both, I find both helpful. And again, with the lozenges, the bioavailability, how much gets absorbed from the body is slower. It's about 30%. So, we have to use large amounts of ketamine for the people to get the same effect. And people have to hold the lozenge in their mouth. It's a sublingual absorption. So that adds, some challenge for some people, like not swallowing and holding it in their mouth for 10 to 15 minutes. And, it doesn't taste great. But as well, it allows for kind of gradual onset of the medicine. So when someone's coming, for the first time, we always use lozenges to kind of help people ease into the process, get to know the ketamine space. And, so I often say that the intention for the first session is really just to start the relationship with the medicine and to feel comfortable. So the person can be open and trusting and allowing the inner healing intelligence to come out. Like that's a principle that we believe that, like, every person has their innate capacity to heal, and these medicines allow for that to come through. So that the first session is really for people to get to know the medicine. And so with the lozenges, it's easier because the onset is gradual. We wait, we start with just one lozenge, and then maybe we add another one if the person feels comfortable. While with the IM, the medicine comes on very fast. Like, you give the injection, the bioavailability is much, higher. It's like 93 to 96%. And, within a few minutes, the person is in the ketamine space. So, the benefits of the IM is that, some people have less side effects. So some people feel one of the side effects is nausea. And, with the lozenges, it seems to be higher than with the IM. People get there faster, and you can use smaller amount of ketamine to get the same effect. So it's less taxing for the body, and you can use higher doses. So with the lozenges, there is kind of a limit how many you can take. While with the IM, if somebody's, maybe a bigger, done the treatment and needs a little bit higher dose, we can go higher with the IM. And then as well,
what are, like, some normal or typical dose ranges?
Yeah, so it goes, from light, medium to high, and depends where we are in the process of psychotherapy and what kind of changes we want to support the person. So there, it's a developing field. So we are kind of developing these protocols as we are going, but we're learning a lot about the variety of doses for different things people are coming with. And then as well, seeing how person responds. But in kind of general, the lower dose is what a lot of the IV clinics use as well. So there is, it's kind of like the sub-psychedelic effect. So, the one formula is milligrams of ketamine per kilogram. And so around like 0.5 to 0.8 milligrams per kilogram would be like the lower dose. And so with lozenges, that would mean, 1, 2 lozenges. And then there is a moderate dose, which would be from about 0.8 to 1.2 milligrams per kilogram. And so that could be like 2 or 3 lozenges. And then the high dose would be, 1.2 to 1.5 we don't do more than 1.5 pill program in our setting, but there are some therapists like Eli Kolb who has used in the past higher doses, like 1.5 to 2.5. But, the higher you go, there is as well increase of amnesia of the experience. So we're trying to come to a dose that person has the experience, but as well can bring, things back. And yeah, so that's kind of about the variety of doses.
Yeah, with like multiple lozenges in your mouth and having to hold them in there, that probably gets pretty rough. I hear it's not very tasty.
Yeah, they come in different flavors, but I've not yet had someone to guess the flavor. It's kind of like a chemical taste. But it's not actually that bad, because the part of the ketamine is there is this numbing feeling.
Okay.
So after holding it for a while, you're not tasting it as much.
Right.
And so, for many people, it's actually not an issue to hold that in their mouths, and they enjoy the gradual onset. And, it's in these lower doses, it's, I would more than psychedelic would say it's like a psycholytic therapy, which means that, person is more open. They're kind of more in their heart, and, their defenses or ways they protect themselves kind of loosen up. So they have access to more, of like what's going on, or ability to have better insight without being triggered by getting, shut down or upset, and can kind of look at things they're working on. And so that, and it can be done with the lozenge, or it can be low dose injection. I've done both, that I've used, low dose IM and did, psycholytic therapy with that. So,
yeah. And with the low doses, so you said that you operate off of the Groff model, and so eye shades, music, more internal, maybe refocusing the person internally. When you're using the low dose, more maybe psycholytic, would you be talking to them or doing a therapy session, or is it more trying to refocus somebody inward as well?
Great question. And so it is the same model, but there will be more interaction in the lower doses. So we always, invite people to, and with ketamine, it's actually kind of easy to have the inner focus for most people, because it's kind of like, the property of ketamine is dissociation. So actually we, kind of prompt people to see where they are, like I'll ask, what you're noticing now, or where are you at? In the higher doses, when people have visions, and say, what are you seeing now? And in the lower doses, where people are, able to talk more, they're still, lying down on the couch. They have the eye shades, the music, but they're sharing about what's coming up, and sometimes it can be, just insights. Sometimes there are memories that come up that are connected to their struggle. Sometimes they do, full trauma processing, so that they might have almost like a, the memory of what happened comes back, and we are working, like I, would work in, like a somatic psychotherapy, or, there's an internal family systems therapy. So there is ways how we talk and work during the session. And, and then there are times when they might go more inward and then come out. So that, the talk and interaction during the ketamine is more with the lower doses, but then with everybody, we do more of the talking as they're coming down, as the drug is wearing off and they're back to, more ordinary consciousness. Then we start to talk about like what happened in the session, what they've experienced. And then, so, this is the difference. With the higher dose, we do the talking, but just before and kind of as they're coming down, while as the lower dose, we can talk during the time on
the session. Yeah. Cool. So we've gotten like a lot of emails throughout the year about like how to find a guide and stuff like that. And, part of this article we wrote a little bit ago was, there's legal options in the States here, right? There are ketamine clinics, there are people doing ketamine assisted psychotherapy, but for some people it's like, I don't know, maybe not as sexy as doing MDMA therapy because they're hearing about some of that research, or, doing mushroom work or whatever that is. What do you like? Could you describe maybe like the differences between like ketamine experiences versus like a classical psychedelic experiences? Are there differences in those transpersonal states? And maybe like what have you seen?
So there is not one answer, and I think there is difference with all psychedelic medicines. The thing that was attractive to us, how we originally started, was that this is one way how you can do this work legally. And I think that even when people go to underground therapists, there is that feeling of like, wow, I'm doing something what is not legal, and that that they kind of like feel like the person who's providing it is putting themselves in danger, and then they have like how many people I can share this with and how people going to respond to them. So already that influences the setting, unfortunately. And we were working on the MDMA clinical trials, and then we're reading and talking to colleagues who've been working with ketamine already and wanted to be able to offer this work to people, before these other medicines are legal. But saying that, I think we would still work with ketamine even if other medicines were legal, that ideally there would be, that people could choose what is that they need, and so ketamine is, very successful with treatment of depression, and I've had great success with treatment of trauma. And especially in the lower doses, it seems similar to the MDMA assisted psychotherapy, that there is really this empathogenic state where as well people are able to, and I think that the mechanism is different. So, right. In MDMA, the MDMA calms down the amygdala, the fight or flight response. While in the ketamine, there is kind of dissociation from that. So it seems like it's very similar how people, they're able to look at these things without getting overwhelmed. And then in the higher doses, the ketamine has been compared to high doses of LSD or psilocybin. So that, when we go to those higher doses, there is there is a difference how that feels, but it is comparable in what people experience. So, the high dose ketamine is described as a +4 on a Shulgin scale. It's, there is like a full ego dissolution transcendental state that people can experience with ketamine.
Right. Really interesting. I think it was like a little graph. I think Earwood put it together about ketamine being more associated with like near-death experiences versus like, say, like DMT, which, you always hear DMT is like more associated with near-death experiences. And I just found that really fascinating. I was like, like, I'm really interested in that all of a sudden. Like, what is that experience like? Because I've had a near-death experience, so I'm really curious on like the similarities there.
Yeah, and so that is so when we go from the moderate to high dose, there has been so there is different ways how people describe like ketamine in low, moderate, and high doses, but a higher dose, moderate to high dose, are described that people can have near this like experience or the ego dissolution transcendental experience, and so the near to death experience is described by many people of kind of having a review of their life, like looking at different decisions they made, how, things they wanted to do differently, a lot of forgiveness, empathy for themselves and others in their life, up to like kind of moving into the space of light or universe. And when they come back, there is, and sometimes it is connected with this fear that people, dissociate from their body, and they have this panic, like, I'm not coming back. Like, I've, done this, and I'm the person who, didn't make it through. And then when they come back, there is this kind of renewed energy for life or make changes, and some of the things they can just almost effortlessly change, that something just became so clear. So it is something what is described and what people, at times do experience.
Yeah, it's really fascinating. Really interesting.
Mm-hmm. Mm-hmm.
And that's a really interesting application with trauma, right? Because one of the key symptoms of trauma sometimes is dissociation. So it's interesting to have this dissociative anesthetic being used. It seems like you said it seems beneficial when you're doing trauma therapy, but also maybe with some of the somatic stuff that you're doing as well, is like trying to work with the body when they're coming back.
Yeah, it's interesting, and I don't know if I have the exact answer how it works,
Right.
but there is different ways of dissociation. So the dissociation that happens with ketamine is different than the dissociation that happens with trauma. With trauma, so when we kind of talked about the depression and anxiety, so if you think about a nervous system, when something's happening and the person kind of goes, out of their ordinary state, they feel more, anxiety or anger or fear or panic. And when that is too much for the nervous system flips and goes to feeling like tired, overwhelmed, depressed. And in that area, which is caused by the triggering of the overwhelm of the parasympathetic nervous system, is dissociation. So there, the dissociation is kind of having relief from, what the nervous system cannot kind of handle, or, and it's a life-saving way. So it's a way of how, our nervous system works. While in the ketamine, it seems like it works differently because it, brings the person out of the body without being overwhelmed. It's not what the nervous system does. And so I've seen that for some people, it actually dissociates people from dissociation.
Right.
So people who are not in their body or not able to feel their body are suddenly able to feel themselves, feel what happened, what was the effect on things on them. And so many, many times people say, like, I've never felt like so much in my body. I never felt so alive, even though they're on a dissociative. So it's kind of interesting to see that.
I think that's the way I think I would probably think about it, like dissociation from dissociation, right? Or dissociating from dissociation. Being able to step outside of that for a little bit and realizing, like, whoa, I have a body and what have I been doing, right? And so having these experiences, stepping outside of that depression or that like really lethargic state and being like, whoa, okay, now I'm back here. Now what am I doing?
Mm-hmm, mm-hmm. Yeah, and there has actually been a study that has shown that the higher the dissociation was during the ketamine experience, the higher the antidepressant effects were. And, how I understand it, the dissociation in that study was measured, the mystical state or the height of the non-ordinary state that the person experienced correlated with the higher remission of depressive symptoms.
Interesting. Really interesting. And you have some training in somatic experiencing, is that correct?
Yeah, so I studied, I did, I'm a somatic experiencing practitioner, so I did that for 3 years, and then I continued with organic intelligence. So my teacher of SE started kind of a, just a little bit modified. It kind of came out of SE. It's called organic intelligence. And so then I assisted with him and studied. And, I'm not practicing fully like a somatic experiencing or organic intelligence practitioner, but it informs everything I do, kind of tracking of the nervous system, supporting people where they are and supporting them in understanding what's happening for them. And I found it extremely helpful. I wish that every therapist was studying SE or OI as they're getting trained.
Yeah, and I guess that was like kind of like where my question wanted to go. Like, how important do you think some of the somatic component is when doing, work with non-ordinary states and just working with trauma in general?
Mm-hmm. It's the key, element. And Stan Grof talks a lot about body work and kind of connecting with the symptoms in the body and really even, making them stronger to be able to kind of understand and move through them. And so everything we experience is stored in our body. Mm-hmm. Trauma's stored in our body. And we don't pay a lot of attention to it. No. And so, yeah, it's like, we don't want to feel like I feel, uncomfortable or anxious or, like ache here. So like people want to move away from those things when the body is kind of calling for attention. And it is really liberating, and being able to connect and help someone to move through that in their body. And the psychedelic assisted psychotherapy allows for more, comfort with that and kind of supports that work. So I think it's essential, one of the key components of the work.
Definitely. It's probably one of my biases too. So having background in holotropic breath work and, being able to do some of that work with Stan, do you include any of that type of body work into your sessions, or?
So you're a holotropic breathwork facilitator, yeah?
So Joe and I trained with teachers that are holotropic breathwork facilitators.
Oh, okay.
They've been doing it for about like 25 years. And so they're kind of passing it down, and we call it transpersonal breathwork, but yeah, same lineage.
Oh, awesome. Yeah. So, the work, I think in breathwork, people are always invited to kind of connect with the symptom in the body before somebody comes from outside to do the body work. And so we use the same principle of, inviting the person to kind of connect with the feeling and stay with that. And then I use touch as kind of on case by case basis. So if the, person feels comfortable with that, and, it's different because the ketamine is the dissociative. Mm-hmm. So people, kind of leave their body. So sometimes they're having the experience and having sense of feelings, but as well are disconnected from their body. So there is more of that, kind of towards the end of the session, but sometimes, as well during the session. So, I would say definitely yes, but it looks a little bit different than even in the MDMA work. So in the MDMA clinical trials, we use more of the same body work as Stan taught in the holotropic breath work and in the LSD psychotherapy book.
Cool. I started writing this little article. I haven't really talked about it publicly, but it was just an idea that kind of crossed into my head that, so Stan's cartography of the psyche, he kind of hints towards the body through body work, but, you have the transpersonal, perinatal, biographical, but, I think like that fourth one could be the somatic, because the way into some of these experiences is through the body, right? And having my own kind of like somatic practices, I can have very deep transpersonal like experiences by getting in touch with the body and kind of going inside. So I almost wonder, like, part of the psyche, right, or part of that cartography is actually adding into some of the somatic layer as well on top of the transpersonal somatic. I mean, they all kind of blend together at some point, but
Yeah, I'm really excited. I'm excited to hear about your article and thinking about it. And I agree that the somatic is part of all of that. Mm-hmm. Right? Like, we are having all those experiences and we are here in this body, and things are stored. The information is stored in our body, and it is like an entry point to all of those kind of levels and realms. Yeah.
So adding a fourth leg to that tripod. Yeah. Mm-hmm. How has like your experience with breath work been? And like the crossover similarities. I mean, Joe and I talk about it all the time, but it's always interesting to hear how it's informed other people's practices, or how similar the experience could be to a non-ordinary or psychedelic experience.
It informs everything we are doing. And I found that it's been so helpful to, do holotropic breathwork for all those years and, as a therapist, become comfortable with, whatever's coming up for people. Because, sometimes people go through really deep process, and someone's tendency might be like wanting to make the person feel better or help them not, be in the difficult place. And by, sitting with, so many breathwork sessions, it made me really comfortable being with, anything that comes up, and knowing how to, let the person just support of going through that. And so, one of the examples would be that, happens often in ketamine assisted psychotherapy, and it is as well part of, SE works with that a lot. And it's kind of releases from the body, which can look like trembling or, like sometimes called kriyas, but sometimes it's, just these kind of stuck energies, or, in SE called like unfinished motor movements. Like maybe, you were falling off the bike and you wanted to kind of, stop yourself by putting hands in front of you, but it just happened too fast and then you got injured. And so there is like this movement that your hands wanted to do that never happened. And so we say it's kind of like, stuck in the body. And as, the ketamine oftentimes comes on, people start to have these spontaneous releases of energy, and, they might be like shaking, kind of without their control. And it's very important just like allow for that, and so I feel like that, doing the breath work is one of the things that taught me how to be able to, just support people in that. And, all the things like the music and the internal focus, it's really, the same what we use.
Yeah.
And, one thing we are exploring, kind of as you're talking about this and the question before, is adding things like after ketamine sessions, like doing body work, or even a massage or acupuncture or sound healing. So something that can really support the integration even more as the person is coming back and shares about what came up. And then before kind of going home, having something what continues to support them in a nonverbal way. So kind of like in their body. And so we're just kind of starting to experiment with that, but our hypothesis is that it will be very helpful.
Yeah. Does your center do any integration work? I know you mentioned before you'd really encourage people to have a therapist outside of there. So I'm guessing you guys don't typically provide that type of support and therapy. You're just doing some of the ketamine stuff and maybe a little bit of integration, but really encouraging people to go elsewhere for therapy, or how does that work in terms of like integration?
Mm-hmm. So as the sessions are 3 hours long, probably, the last 30 to 90 minutes of the session is the beginning of the integration. So the person, as the medicine's wearing off, we are starting to talk about like what came up, how that relates to their intention, what are some things they, want to do and kind of, or, help them to kind of have a new relationship to what came up. And if the person likes, they can have another session with us. So we, offer psychotherapy and integration sessions, but we as well encourage the person to do that with their therapist. So we communicate with their therapist what came up in the session and work together with them, so the therapist knows kind of what they're going through, what came up, and how we can support their therapy and the therapist can support us. And the idea of the regular therapist is that we have, we're just right now, there's 8 of us providing CAP in Polaris. And, the sessions are 3 hours long. Sometimes people come for a series of 6 sessions. And so in order to be able to provide it for more people, we cannot take all the people who come in as our individual clients. And so, it's because it's something really specialized, what we've been trained in and developed, that we want to be able to offer it to more people. And so that's why we, don't work with the person as well on ongoing basis. But we think it's extremely important to have that. And right. to, and people who engage in the CAP and who engage with their individual therapy, the results are really amazing.
Yeah, that makes sense. That, you guys are specializing in this and really encourage people to go elsewhere. Do you guys do any mandala work afterwards?
We haven't, but I encourage people to draw, when they get home. Sometimes the effect of the ketamine is that even when you're back to ordinary consciousness, you still might feel a little bit altered. So sometimes people don't have like a perfect vision as they're coming out. So it's not the easiest to be writing or, drawing. But we have, papers and crayons and pencils available in our rooms. So if people like, they definitely can. And we encourage people to do that, but we haven't done it as a kind of a part as it is in breathwork, for example.
Right. What is it like for you to do this therapy sitting with people? Like maybe just some insight for other therapists that might want to get involved in this. Like, what's your experience been like, and what is it like to offer this type of therapy to folks?
Yes, Kyle, I feel so grateful and, to be able to do this. It's been really amazing and kind of, my dream for the, 18 or 20 years to be able to combine working with neuronerve states and psychotherapy. And I've before, sent people or they would go to breath work and then work with me. But now really being able to offer this to people, it's amazing. And, seeing the transformation that can happen and that it's not successful for everyone. There are people who do not benefit, people who it's not suitable for, but then there are people who, have done changes in a few weeks that we're not able to do for years. And so it's really beautiful to be able to witness that and support people on the journey. So sitting in the ketamine sessions, it's really beautiful and wonderful. And I think the presence that we kind of bring as well helps people to go deep, in our trust in the medicine and in the inner healing intelligence is kind of what supports the client to trust, the process with us. So it feels like a really sacred, beautiful work. Yeah.
Imagine. And are you doing pair therapists or is it one-on-one therapy with clients?
So we do one-on-one. There are occasions that we do therapy pairs. So we've had some clients who, for different reasons, we thought it would be more beneficial for them to work with two therapists. So we have that option. But in general, to be able to offer it a little more affordably, we do, one therapist. The MDMA model has two therapists, but as well, in the MDMA therapy, the sessions are 8 to 9 hours long. While here the sessions are 3 hours, and part of it's kind of internal and it's really sitting and holding the space. So, if we do intramuscular sessions, it's the therapist and then the doctor or the nurse comes in. So there is another person present if for whatever reason was needed. And yeah, so it seems like it's easier to do as one person because of the length of the sessions.
Yeah, that makes sense.
But I love working in the co-therapy teams. I've first started doing in the MDMA clinical trials and have been, really fortunate. So my co-therapy partner, Harvey Schwartz, he's as well one of the therapists in Polaris, and it's been wonderful, working with him and learning from each other and supporting each other and kind of providing the support of two therapists to the participant. It's, really wonderful. So we've done it with, for as I said, for different reasons for some of the clients in Polaris, and it's a different way, but it's really nice as well.
Right. Yeah. Yeah. I can imagine that's probably helpful for certain people coming in with certain traumas and stuff, and just having that male female pair can be really helpful for some people just for safety. Right.
Yeah, so we've done that. We've done, male, female, exactly for those reasons. And we've done as well male therapy teams. And there was, there's a huge healing in for some of the clients to have the support of two men, that there is just being able to be vulnerable and sit with, two men who are in their hearts and supporting you, that can be really healing experience for people.
Yeah. What do you think the future of ketamine is now that S-ketamine might be coming on to the scene pretty soon? I don't know, where do you see things heading, or is there anything you're excited about, maybe a little worried about?
Mm-hmm. I'm really curious about what's going to come. There are a lot of possibilities and hypotheses. One really positive thing. I think that more people are hearing about ketamine and are more open, and then they're researching, and they're considering, like, is the IV or is the nasal spray for me? And then there is this other option of the ketamine assisted psychotherapy. And, so I think it's kind of spreading the word, making people more aware of how psychedelics are used or how these psychedelics effect can be beneficial. The concern with, both for me, with the IV clinics and the nasal, is the set and setting of the treatment, and that people are in this open state in spaces that are not really conducive for the deeper work. Mm-hmm. And, many people are able to, like, they don't go as deep, and it's just kind of relaxing state. But some people have memories come up, and, so I cannot imagine yet how kind of these rooms, when you get a nasal spray, like, where are you going to be sitting in the doctor's office? Right. And these things start to come up without having a support. So that's my concern. That, and sometimes people just will say, like, oh, it didn't work for me, and they don't continue, but there maybe was something what was coming up for healing that, could be supported. But I have, I think I'm more optimistic and positive about thinking in the future, and hopefully when other medicines are rescheduled, when we can use MDMA, psilocybin, and that ketamine still will be an option, what can be used for people where it's, indicated, and that we can continue seeing the benefit of the ketamine as well as the other medicines.
Yeah. Two questions are popping up. One was just maybe a quick commentary about, like, being in that medical setting. And I always think about, like, that coming from more of that transpersonal realm, and, like, when you're in these transpersonal states, like, what are you opening up to energetically, and how is that affecting mm-hmm. you, right? Or, like, what's coming into your field during that time. And the other question that popped in my head was more along the lines of, like, I think you touched on this before, like the difference between different psychedelics and ketamine. Like, yeah, what do you see the potential for ketamine? What do you see the potential for other psychedelics? Joe and I have talked about this, like, you don't mm-hmm. clean a house with one tool, right? There's different areas to kind of hit different spots and whatnot. And it seems like that's the case, right? Like, it seems the focus has been for ketamine for depression, and it's been really, it seems good reports for suicidality and suicide ideation. So yeah, I'm wondering your thoughts on maybe how these different tools could be used and what they might be good for.
Uh-huh. Yeah, and so with the ketamine, the research has been done on the depression and suicidality, because that's what they can do in the IV infusions. There is one study which has been recently published on ketamine assisted psychotherapy, and then there are, reports from Eli Kolb, Evgeny Krupitsky from the past. There are, few studies here and there, but really very few. So it is a new and emerging field, and I think we're learning who it is useful for and who it is not. And we've seen great results with, anxiety, trauma, PTSD, depression, end of life anxiety, loss and grief. It has been, amazingly helpful for people. Kind of when people feel stuck and they, kind of stuck in their therapy or in their life, that it kind of allows for this other perspective and people are able to kind of move forward. So I think there is much greater use than it, has been researched, and we are still learning. And I think the same with, MDMA and psilocybin, that with MDMA is now being researched for the treatment of PTSD. And I, do think that it's, for most people, it is the superior choice for treatment of PTSD. But each has its, cons and pros, and so even just the length of the sessions, right. And, and we would love, like, MDMA. It's like, it would be perfect for a couples therapy, but, like, we can prescribe a medicine to help a couple, right now. So that there are these possibilities once we are able to use these medicines for off-label use, that I think we'll kind of see them being used in a variety of ways.
Yeah.
Yeah.
Do you think breathwork has any place in this world of, like, therapy, or like an adjunct to therapy or anything like that?
Absolutely. Yeah, I loved working with breathwork. I had, practitioners that I referred to regularly. And, there are people who might not be able to take the medicine for different health reasons. So that would be, like a definite option to do breathwork. Some people might feel more fearful to start with psychedelic medicine. They might use a breathwork. It can be really helpful as a part of the integration, so that maybe there are medicine sessions kind of further apart from each other. And between of those sessions, people go to holotropic breathwork and continue, or, other breathwork, continue the process as a part of the integration work. I think, our breath is powerful, and kind of our ability to go to these non-ordinary states without medicines and kind of continue to work. And, a big part, like what I didn't mention, and I want to make sure that I say, that big part of the healing is as well having a positive experience, kind of not only going into the trauma, depression, or where it's stuck in the body. It's as well connecting with places that feel good, that we can, inhabit, and having, positive visions and kind of journeying in beautiful spaces that, that is so supportive for our nervous system and ability to heal. And that, we kind of, that's what, as well as he talks about a lot, somatic experiencing, that, sometimes like you can actually heal the trauma, even just going through the motions of something positive that we are experiencing, and it can support the nervous system for healing. So, it's important to remember that, and that, people like who are depressed maybe haven't felt kind of ease or relaxation or happiness for a really long time, and they're able to feel that during the medicine session. And then it's kind of like, okay, this repressed feeling came up, and how they can continue to stay connected to that, and it's like changes they make, if it's being in the nature, doing things that feel good, movement, dancing, but maybe breath work, meditation, yoga, all these things that kind of support reconnecting with that state. Mm-hmm.
Makes me think about, it seems like sometimes in the psychedelic world, it's like sometimes those dark, really challenging experiences is what create positive change. And I've been thinking about this, between the balance between good experiences and how transformative those could be, versus going in deep into the psyche and dealing with some of that more depth, dark oriented stuff. And where's the balance there? Because it seems like everybody's like, oh, just ego dissolution and really go in and heal this and deal with this darkness. But what about the positive aspects too?
And I think that when we really allow for that inner healing intelligence to come through, it will take us where we need to go. And so welcoming and opening to whatever it is that shows up. And, sometimes when somebody, I've worked with people who believed kind of what you're saying, that they were connected, and it's just we were floating and feeling beautiful and having beautiful visions. And then this voice came and was like, you're not doing the work. You're wasting your time in this ketamine session. You need to look at your trauma. And so then the ego comes and okay, take the trauma out. And sometimes even the inner healing is like, no, you cannot go there. You need to be in this good space right now. And, and sometimes it takes us to the dark places. And again, it's the same, welcoming that, so that we trust whatever's coming up is coming up for healing. And if it's beauty, and that's part of that, and that's, I think, such a gift that, maybe people, and some people, experience that. And then maybe that's just a stronger experience of connecting with that. But some people, haven't had that connection with the positive or good experience for, different reasons in their life. And so it's such a gift to be able to have that.
Yeah. I'm definitely guilty of wanting to just dive into the depths. I know in some breathwork sessions, if nothing deep is coming up, I'm like, yeah, this is a waste of time. But then I realized oh no, my body actually just needed some rest, and I needed to experience this. I don't know why I keep wanting to figure this thing out and get to the core of it. So I think that's important, is to also embrace some of those positive experiences, and it doesn't always have to be about deep work and facing some of those dark places of our psyche.
My experience is that it's kind of the ego dissolution or this kind of bliss state comes after being with and accepting whatever's coming up. If it's good or bad, just really like allowing yourself to be in that. And that, like, that's where kind of suddenly the transformation happens to the complete bliss. Like when we are not pushing away anything, if it's good or bad or, challenging. And so it's kind of learning to opening to what is presenting itself.
And that's kind of like in the realm of SE, right? Like trying to really befriend some of these positive sensations and negative sensations and really just like be okay with what's going on in the body and learning how to accept it or just be with it.
Mm-hmm, mm-hmm. Yeah. And some experiences be like following these impulses in the body and connecting with the positive is really important, because sometimes people with trauma or kind of this dysregulation in nervous system have this tendency of, going into the darkness and, looking for what's wrong. And, and then, even our society is like pushing people to be in this activation, like do more and have another coffee and do this, like to push yourself, and that's good. And so people can have very little experience with that kind of connecting with what's good, what's calm, what's supportive. And, when they stop and they start to feel anxiety or, and so big part of the work in SE is to establish this connection with what feels good, like where we can be in the body. And that allows us then to be with what doesn't feel good in a more healing way, that we can actually move through the challenging feelings. So, I think it's like I loved, in SE, there was like we would say like, do more of what feels good. It seems really simple, but just like really following that, like do what's good.
Right. But as you mentioned, some people have a hard time doing what's good or even feeling that, because it could activate another process, right? So how do you even embrace what feels good?
And so it's starting really slow.
Yeah.
It sounds like funny, but it's like too much of a good thing cannot be great, because it can bring up like the opposite, And so I've worked with people who've had, like that they just their life, they were like, well, it's, easy for someone to say, but just like everything in my life is horrible and all this trauma that happened, there is really nothing good. And it makes sense. And so maybe it's just connecting with something what feels good for, a few seconds in the beginning, like, or maybe what doesn't, some people come and they're like, I have pain everywhere in my body. And, and so maybe looking even for something what doesn't feel as bad as something, maybe just connecting with something what is not as bad as the worst thing, and then kind of letting that go. So it's kind of, we're training the nervous system to be able to stay longer with the feeling, the good feeling. And I think the medicines kind of help us with that. So we have like a great help of like, okay, that it makes it easier to do so, and that sometimes it's really takes less work, and maybe something what would take, weeks in SE, that with the medicine, the person can respond to that like much faster, that they, can just provide support, like of, and encouragement and trust that it's okay to be with the feeling, and they're able to feel that. So, but as you're saying, it's just kind of starting slow and feeling like a little bit of that at a time.
Yeah. Slow is good sometimes. You don't always have to jump in the deep end and flail around. Do you have any, I guess, like advice for therapists that might want to get involved in this work, or maybe grad students that are like looking to get more involved in this? Because, it does seem like this is a legal option, and people could start to get more involved versus, MDMA might be a little ways out. They need to finish up their clinical trials, and, they are training therapists at this point for expanded access if they get approved for that. But I don't know, any general advice for listeners?
So there, people who are working in the helping fields of, and so there are trainings in Ketamine Assisted Psychotherapy for therapists, nurses, doctors, chaplains. So Phil Wolfson has a training institute in the Bay Area, and he does, I think there's like 6 trainings over the next 6 months all over the US. Raquel Benet, the Kriya Institute. She does a lot of talks and some training on ketamine assisted psychotherapy. And there are, several new training opportunities just kind of being created as we are talking, because it's such a new field. So that's kind of the options that they are here now, and they're great. So I've trained with both of them and continue to consult and kind of study with those groups. And it's, extremely helpful to have a community of people interested in this. I do think that it's important for people who do this work to have these experiences and the training and there are therapists who start doing ketamine assisted psychotherapy without a training. So, I recommend for everyone to do these trainings. And then, as you said, there is a CIS, California Institute of Integral Studies, there is the program certificate in the psychedelic research and therapy. So that is really popular way of getting trained in, kind of more broader way of psychedelic assisted psychotherapy and research. And then MAPS has open applications for the MDMA assisted psychotherapy for the expanded access. I know there is a huge wait list, but as well, they're, offering more and more training. So people are being trained through that. And anything that, so people, when they're going to school and want to do that, there are ways of getting involved in the field by, volunteering, for MAPS or, at different conferences, and kind of being involved in things that can, support them in doing the work. So somebody might choose to go to, become a nurse practitioner or, like a naturopathic doctor or a psychotherapist. And, the thing that, we don't know, but what MAPS is applying for the expanded access and then, for the future, that not both of the people in the therapy team would have to be licensed psychotherapists. So there is a hope that people who are not counselors or not psychotherapists would be able to do the training and work as a facilitator in these sessions. So, maybe volunteering and getting, familiar as much as people, want with the field is, very helpful. Phil Wolfson, he put together a book, The Ketamine Papers, which is great for anyone interested in working with ketamine. So I highly recommend that.
Awesome. Thank you for that. We're over an hour. So any last words of wisdom and anything that's going on, with whether that's Polaris or whatever you're doing that you want to pitch?
Thank you for having me and talking about this. And I'm, very excited about this work and, wanting to people know about kind of the possibilities, and kind of demystifying ketamine. And, a lot of people have had as well negative experiences with ketamine recreationally or scary. And so that doing it in psychotherapy can be really healing and reparative. And so Polaris Insight Center is located in San Francisco. So we work with people all over the Bay Area. We have people who come to work with us from other places. They come for a week and they do several sessions during that time. We, just as well are available for consultation for people who, are interested in the work, and as well people who are interested in doing the work or starting clinics. So we've, helped and consulted with other people who are wanting to do this work in other places in the US.
Awesome.
Always available. People can email me and I will respond.
Awesome. Sounds good. Thank you. And I'll do a quick little pitch. So, Veronika and I were both on a podcast separate, recorded with the Consciousness podcast with Stuart Preston, episode 23. I really enjoyed listening to it because I think my track was first and then yours. I was like, wow, Veronika has such similar things to say. It seemed like it was like kind of like a similar conversation, and it does seem like we have a similar theoretical background and a way we approach this stuff. So I'd suggest go checking that podcast out. It was pretty fun and interesting to see some of the similarities there.
Yeah, that was awesome.
Awesome. Well, thanks so much. And yeah, anything else? I'm sorry, I kind of cut you off.
No. I was just gonna say it was, I really enjoyed hearing that and the interview with you. And yeah, thanks so much for having me.